This is my grandfather, and this is NFL Super Bowl champion Steve Gleason and famous scientist Stephen Hawking. They all had amyotrophic lateral sclerosis, or ALS. Let's break that down. Amyotrophic. A meaning no, myo meaning muscle, and trophic meaning nourishment. Lateral also means spinal cord, so we get no muscle nourishment of the spinal cord. ALS affects both the upper motor neurons of the brain and the lower motor neurons of the spinal cord. But what is a motor neuron anyway? It's simply a nerve cell. Nerve cells are comprised of a cell nucleus, a cell body, dendrites, an axon, and axon terminals. This one happens to be connected to a muscle. ALS causes motor neurons to degenerate or even die. Normal motor neurons are able to send impulses down an information pathway and tell your muscles to move. This creates a healthy information line. ALS neurons are unable to do this, thus they can't create a pathway. This leads to muscle atrophy. This next graph compares diseases via the number of people in the United States that are affected. Diabetes affects over 20 million people in the United States. Alzheimer's clocks in at 5 million people. Breast cancer at 2.8 million. Multiple sclerosis, 400,000, and ALS, only 30,000 people. This makes it an orphan disease because it affects very few people. Out of those 30,000 people, about 60 to 70% are men, while 30 to 40% are women. There are two types of ALS. 5% of the cases are familial, meaning someone else in your family has it. The other 95% of the cases are sporadic or random. This next graph is an approximation of the number of people diagnosed compared to age. Most people are diagnosed between the ages of 40 and 70. The mean is 55 years old. It's not unheard of for someone to get diagnosed younger. Stephen Hawking was diagnosed at 21. One factor that can lead to ALS is military service. If a normal person has one chance of getting ALS, then a military man like my grandfather has 1.5 times the chances of getting ALS. While Gulf War veterans have double the chance of getting ALS, no one is sure why there's a correlation between ALS and military service. This next graph shows the number of years after diagnosis an ALS patient can expect to survive. About 50% of people with ALS will survive 3 years after diagnosis. This drops drastically to 25% who will survive 5 years, and only 15% of people will survive 10 years. Very few people will survive the Stephen Hawking 50 years with ALS. ALS patients experience many symptoms. These include difficulty lifting toes and fingers, hand weakness, slurring of speech, muscle cramps, muscle twitching, breathing problems, eating problems, dementia, excessive salivation, fatigue, and paralysis. No matter what order or symptoms an ALS patient faces, it usually ends only one way: death. Next, we have a pseudo-Venn diagram on the treatment of ALS. The green circle represents diseases with cures, while the blue circle represents diseases with FDA-approved drugs. ALS is in red. It has one FDA-approved drug, Riluzole. In effect, ALS constitutes progressive imprisonment without parole. First you lose a digit, or two, then a limb, then, and almost inevitably, all four. Tony Junt, Knight, who died of ALS in 2010. For more information, visit the ALS Association at www.alsa.org.